Hi everyone, this is Dr. K. Wanted to say hi to you and talk briefly about some of my experiences over the last several days. The overall volume has been down in the hospital. Not many people are coming in, and it's understandable. The reason why they're not coming in is they don't want to be exposed to the virus, so they're trying to stay home, which is a good thing for them. Sometimes it is counterproductive. There was recently a case reported by one of my friends, and he was working in the ICU, and this particular client was from Granville Nursing Home in Newport Richey, and this particular client was in the 80s, relatively elderly, and the client had pneumonia for 4 days. Hi Lorena, thanks for watching. And they were trying to treat the pneumonia in the nursing home. So the problem with that is you really don't know what you're treating, and they can only do oral antibiotic in the nursing home. So even if you think it is bacterial pneumonia, you're treating with oral antibiotics, sometimes it may not work. So obviously the client deteriorated over a period of time, and by the time they came to the ER, they were in a bad shape, and they had to put a tube down the throat, and they wanted to admit the client to the ICU. So when my friend wanted to go and do the consultation in the ER, he noticed that the door was open, and he asked the staff, the nursing staff, why they left the door open. And the nursing staff eventually told him, hey, this is not a COVID-19 patient, we know for sure. The client came in for pneumonia and maybe some heart failure, lungs were full of fluid, so we really don't think this is COVID-19. And part of the problem with that statement is you're talking as if you're already treated thousands of COVID-19 patients, and you know how COVID-19 is going to present. Like nobody has treated that many people in the Florida area, so forth, as far as I know. So they're going in with an assumption that they already have a diagnosis and they know what it is, which is a misstep. So by leaving the door open, if the client truly has COVID-19, the virus has now spread throughout the entire department, and you're not disinfecting the whole department. Typically what they do is the staff would disinfect the actual room, and after they do the regular disinfection with the topical solution, then they use a UV light they shine the UV light across the whole room for I think 40 minutes or 1 hour to eventually kill every bug in there. And they can only do that inside the room. They cannot do in the lobby or in the hallway. So in this case, if that client were to have COVID-19, the virus has now spread into the entire department. It's droplets, and it can live up to 3 days from what I heard on surfaces. So so that's another problem. And later, so this particular friend of mine, he saw the client, and then he came out, and then he was not too happy about the way things were being dealt with. And then he was typing on a computer, and within half an hour or so, the client coded, okay? So when clients are deteriorating so rapidly, when they go from, breathing on room air, they go on oxygen, and then they eventually get a tube down the throat, and then eventually the heart stops and the lungs stop working in spite of ongoing respiratory support with the breathing machine, that is a clue that possibly that particular client has COVID-19, and probably they had the COVID-19 all the way from 4 days when they were in the nursing home. So this particular client was never tested, and we would never know. And if the client were to die, I don't know what happened eventually. If the client were to die, then it would be classified in the death certificate as possible death from pneumonia or heart issue. They would not label it as a COVID-19 death. So this is what happens in real world, just so you know. Had like a week ago, one of the doctors told me that they had 2 clients from this particular nursing home called Oak Ridge Nursing Home in Newport Richey. They arrived at the same time in 2 different ambulances. So that's another sign that if there are several clients coming in from one particular location, and they're all in respiratory failure, where they're having they're needing support from either ventilator or so forth, then that is that's a red flag that possibly there's an epidemic of COVID-19 going on in that particular nursing home. Again, I cannot prove that. So the reality is it is spreading. It's not as bad as New York City, but it is spreading in the local area here in Florida. And I can only know by getting personal reports from the physicians. Some of this data is not shared publicly. So I want, if your family members or so forth are in the nursing home, I want you to be very cautious. Check on them on a regular basis, because they may not allow you. At least check on them on the phone, talk to the nurses there, find out if they're having temperature, if they're having some things that are off, they're coughing, and try to take early action to prevent, essentially to prevent death. Because if they're not treated in a rapid fashion, it can lead to death. There's a lot of misinformation. There are a lot of people still think that this is like a flu-like illness which is going to get better. There are numerous strains. From the last thing I heard, there are like 8 different strains of this virus. So one strain can be catastrophic, where it can kill a young person. Another strain can be like a simple flu. My initial viewpoint, if you go back and look at my previous videos a month ago, I was in the viewpoint taken by the public that this may be similar to flu, where the death rate is similar to flu, and it will only cause deaths in older people, possibly. But now I'm changing the viewpoint based on the data that is coming out. I also want to share another example of interaction with somebody from New York. One of my friends talked to a hospital chief operating officer and asked them what is going on. This particular lady, her hairdresser became sick. She had COVID-19. She survived. She knew somebody who was working there who died because of COVID-19. So the reports that are coming out of New York City are actually true, that a lot of people are dying, and that is unfortunate. And the other part of it is they're also traveling. So there are a lot of people coming in from New York City and landing in Florida. There are a lot of flights to Florida, and also they have properties, and they have they may have assets here, and they may have connections. So maybe they're coming for that reason, but I suspect they're coming in to escape the crisis there. So from what I heard, there was one client who landed in the airport in Sarasota, and they immediately went to the emergency room, and they had to put them in the ICU right away. So and this is unfortunate. What's going to happen is the clients who are sick in New York City, they're going to spread it to the rest of the country. But anyway, that's a public policy thing, whatever the government decides to do. So I'm sharing a lot of bad news, but I also want to share some of the solutions as always. I'm really big on vitamin C. So I would advise taking at least 3 grams of vitamin C, at least high quality vitamin C every day. You can split it into multiple doses. If you take too much, you may have diarrhea. Take a lot of zinc and selenium as well. Get some vitamin D. If you can get sunlight, it is good. If you're not able to get sunlight, take oral vitamin D. And try to eat a lot of good nutrition. And I also want to invite you to the forgiveness meditation tomorrow. I'm going to do a session probably lasting 15 to 20 minutes here in Facebook Live. I'd figure out the technology part, but I think it will work out okay. In the forgiveness meditation, it's pretty straightforward. So I'm going to briefly explain the steps, and I'm going to talk about it again in the video tomorrow. The meditation is geared towards relaxing your body, so you can do brief exercises, move all of your joints like 5 minutes or 10 minutes before the session. I'm going to do it at 6 p.m. tomorrow. So you can slightly loosen the body, move your joints, maybe do some jumping jacks and so forth. And after that, you sit down in a comfortable position. Keep your hands like facing to the ceiling. Curl your tongue, put it on the roof of the palate, and then sit down and relax and follow the instructions. So initially we start with focusing on the heart, like putting the hands in the namaste position, touching the heart, thinking about universal love and so forth, and then focusing on the crown, touch the crown. And after that, we go through a series of deep breathing, where I'll guide you through some deep breathing exercises. You inhale into the abdomen and you exhale from the abdomen several times. And after that, slowly raise your hands and focus on the planet in front of you, and focus on all the people that you want to forgive in your life. So, and you bless them with forgiveness, and I'll guide you through that. And after that, you have a period of silence, and then I'll teach Om 3 to 4 times, and after that, there's a period of silence for a few minutes. And at the end, you raise your hands again and bless out the excess energy. Once the meditation is done, you can do some more jumping jacks and loosen the body, move the energy some more. So that's a primer for what I'm going to do tomorrow. It's very important to do meditation in these days because it keeps you sane, it keeps you calm. A lot of people tend to make bad decisions when their emotions go haywire, and a lot of that is happening. So I really wanted to invite you to that tomorrow. So take advantage of that opportunity. If you have any comments, share below. As always, I'm available to have private conversations. I do consultation. You can send me a DM. You can also visit me in my center. We're offering a whole bunch of treatments. I'm talking to a bunch of pharmacists to get more vitamin C shipped over to the facility. It's in short supply. And yeah, thank you, Linda. It is Happy Doctors Day. For any of you who are the doctors listening to, Happy Doctors Day today. Okay, have a wonderful night. I wanted to sign off. This is Dr. K.